I mentioned this in my previous presentations, but I will repeat it here. The structure of this course is based on this circle, the steps of evidence-based practice. We start with asking a question. Last session we discussed about this, how we ask a question. You remember the PICO format or PICO-TT. And now today we have come to the how we acquire the evidence. And this will be followed by appraising the evidence, applying the evidence, and assessing. Then the circle will continue all the way. Asking the questions, you should remember that we have background questions and foreground questions. And as you progress in your career, you go from medical student to resident, trainee, and attending physician. You should be asking more foreground questions instead of background questions. But still, at any phase, at the early stages of your career, you may ask some foreground questions, or in the late career, as a senior doctor, you may keep asking, you should be keeping asking some background questions. And again, a reminder, the background questions had two components, how, when, why, what, and the pathophysiology or clinical manifestations. It is about the epidemiology, pathophysiology, clinical manifestations, the background information in clinical practice. And the answers you may find in textbooks or in outdated old articles, publications may give you also some background information. But for the foreground questions, you need more up-to-date, more new, more recent publications or evidence. And therefore, you are dependent on new medical literature. And the foreground questions are more about the etiology, diagnosis, therapy. They can be of all sorts of dimensions of medical information. One example, again, a question: is metformin more effective than weight loss in controlling diabetes in obese patients? If I have this question, you should remember from the previous sessions that this is a question containing the problem or patients, participants, and then the intervention and comparison groups, metformin compared with weight loss, two groups, and the outcome is controlling diabetes. Okay, so if I should mark these as with categories: problem, intervention, comparison, and outcome. And outcome, we mentioned before, should be something you can measure. How can you measure whether diabetes is under control or not? You can measure the fasting blood glucose. Fasting blood glucose or blood glucose. It can be also postprandial, but usually we measure the fasting blood glucose. Okay. So the evidence you collect can be pre-appraised. What do we mean by pre-appraised? It may help you to solve clinical problems about treatment or prevention, diagnosis, differential diagnosis, prognosis, causes, or it may be also related to economical issues. Whereas in textbook information, you find usually as not so up-to-date, not so recent information, and therefore they are more suitable for background information. Here are some resources listed with advantages and disadvantages. so that you may go and look at them. You may most commonly, also myself, we search currently, we use the internet as resources, like Google, or I will show later some other resources, because most of the published content is now transferred to the internet. However, still we have some textbooks like the Harrisons. These are all up, most of them, for example, the MD Consult or Up to Date, they are also included in the internet. And we have now electronic books, but still we use some textbooks. You see here the advantages and disadvantages. I will not read all of them. Please stop the presentation and have a look at the advantages and disadvantages. Beyond that, we have the secondary journals, pre-filtered sources, or unfiltered databases. Unfiltered means there's the research, the evidence is in front of you, and you are supposed to read, understand, appraise, and evaluate the evidence by yourself. You should be capable of doing this with your available EBM information. So, is a text evidence-based? How we can decide whether the material in front of us, which we are reading, is evidence-based or not? First of all, any evidence-based text should be citing the content. If there is a judgment, if there is a suggestion in the text, you should expect that there is an inline reference given to that command or to that recommendation. And what else? The references should be not outdated, preferably 2 to 3 years old. If it is older than 2 to 3 years, they suggest that this could be used as a background information, but for foreground questions, we should be looking for most recently available evidences. Of course, you may not be able to find any evidence within the last 3 years. Then you are forced. You are obliged. You don't have any other option other than looking for older references, literature. For this reason, the guidelines, for example, the guidelines contain some expiration date, like a medical pill. The pill you're taking, you're prescribing to your patients has an expiration date. So also this information they produce using the guidelines, they have some expiration dates. Here, an example of the German guidelines for dysuria, painful urination. They developed the guideline and they put that deadline when, after which date it should be updated. Okay. Some examples of these online texts, then I will make a stop here. There are many resources, English resources, also other resources. I collected here some examples from the English language references, online clinical texts. Among them are almost all publishers, famous medical publishers like the BMJ. They have their also evidence resources, evidence-based resources. For the BMJ, we have the BMJ best practice. There's the clinical evidence, Dynamed, Essential Evidence Plus, Medscape. So I suggest you to check all of these and even get subscribed to some of them. They also, according to your preferences, some of these online clinical texts resources, they may send you regular updates to keep you current. Okay. Stop recording.